Welcome, everybody. I'm Carla Jamison, UCA's Education Director, and I would like to welcome you to our webinar today on Return to Healthcare, which is a part of our COVID-19 series. For those of you who participated in our survey regarding this subject, thank you. We partnered with Caston Hugh, a patient experience design consultancy firm, so we could share their study on when patients might return to healthcare. Today's speaker is Steve Koch, Senior Vice President and co-founder of Caston Hugh. In his career, Steve has partnered with many remarkable brands and organizations. Through it all, his focus has always been on developing a better understanding of consumers in order to create superior experiences. Some of his clients he has managed include Nebraska Medicine, Ohio Health, MedStar Health, Phoenix Children's Hospital, Northern Arizona Healthcare, Sharp Health, Aetna, and many other organizations. So what's going to happen today is Steve's going to present the data from the study and give you some actionable items to implement in your center. Then Steve will interview Alan Ayers, CEO at Velocity Urgent Care in Virginia. Many of you know Alan from his practice management articles in JUSUM, as well as the content he has presented at UCA conferences, as well as his role as a UCA board member. Steve and Alan will chat about Velocity Urgent Care's journey through the pandemic. Sorry, I think someone needs to mute. Anyway, so we're going to go ahead and get started. If you have any questions throughout, please go ahead and type those into the question box. And then if time allows at the end, I'll come back on and ask those to both Steve and Alan. But otherwise, I'm going to go ahead and turn it over to Steve. Thanks, Steve.
Great. Thanks so much, Carla. And thank you, everybody, for joining us today and talking a little bit about returning to healthcare during this era of COVID-19. So just briefly to give you an introduction to Caston Hugh, our objective is to drive growth, loyalty, and innovation for our clients. And we do that through a human-centered approach to experience design. And what that means is really understanding the needs of those our clients serve so that they can design better experiences for them. And we're in an era where needs are changing dramatically for those that you serve. And that's why we wanted to do this report. And so the report itself is titled How COVID-19 is Redefining Expectations in Healthcare. And we'll make it available to you after this, but today I'm going to spend a little bit of time sharing some of the highlights from it and some of our takeaways and some recommendations around how you can think about your business in this time of COVID-19. So very briefly about the survey itself, or about the report itself, it was actually a mixed methods approach. So we started by surveying a cross-sectional group of healthcare consumers across the country to get their take on how they're approaching their healthcare during this time. And then we followed up with in-depth interviews with a number of those participants throughout the country, trying to dig in on some of these subjects so that we could get some of the depth and some of the knowledge we need to really understand how we can move forward in the best way and how we can give the best recommendations to our clients as they're navigating these times. So, as Carla mentioned, many of you took a survey that we sent out and put together with Carla and her team to just gauge some of your experiences thus far through this process since the pandemic started in February and March here in the United States. And so one of the questions we asked was, what is your largest challenge moving forward? And as you can see from this word cloud, there are some themes that really rose to the top. PPE, volume, safety, how do you think about patients, a number of different interesting responses. We put those into three major categories. The first, increasing patient volume, and I think that's important for all of us. Number two, ensuring patient provider safety, especially by implementing new testing and screening procedures. And then third, addressing patient perception, especially around trust and safety and necessity of urgent care and things of that nature. And really in this report and what we'll share today, We'll talk about number 1 and number 3 primarily. We'll be touching a bit on number 2, and then of course, as Alan and I have a conversation later, we can touch on all of these challenges. But for now, I want to jump into the report itself, which is really focused on what needs to be done to rebuild patient volume during this time. And I'm going to start by sharing some foundational information that we learned as we talked to consumers and surveyed them. And so unsurprisingly, about half of consumers, more than half of consumers, are worried that COVID-19 will affect their personal health. And that is not terribly surprising. We looked at this, and I'll mention also that this survey and the interviews were done in late April and early May. So about 5 weeks ago. So at that time, we saw that about a quarter, a little bit of over a quarter of folks were extremely concerned, and then another quarter were very concerned. So a large group of people really have high level of concern around COVID-19 and how it could affect their health. And when we went into the interviews and talked to folks about this, one of the key findings was just that people were really having concerns, not about themselves, but around everybody around them. Family members, especially older family members, those with pre-existing conditions such as diabetes and high blood pressure, and just the unknown. And I think that's been consistent throughout this. You know, when we did these interviews, it was right about the time that children were starting to be affected by it. There was also started to be news of young people having strokes without any other symptoms. And we've seen even since then, in the last 6 weeks, there's been other new findings that, you know, tend to alarm people about how this could affect them and how it could affect their family members. So certainly as we saw those people who fit into that group of being very concerned about this, they had that concern across not just themselves, but friends and family who they thought could be affected. And we saw that about 40% of consumers had delayed care due to COVID-19. And so to be specific, these were people who had appointments or procedures scheduled prior to the start of COVID-19 that they ended up having delayed. And so that's a pretty significant amount when you think about it in terms of the amount of the population that has put off medical care. And even since then, we've seen even more news about the detriments of this, the fact that visits for strokes and other urgent and highly acute issues have gone down in emergency departments. And so this is something that we're all working towards. How do we create an environment for people to be more comfortable to get medical care? And again, the themes here were around the idea that everybody was postponing them. Providers were, patients were, and the reasons really ran the gamut. We'll talk a little bit more as we go through the report about what's going to make people more comfortable to get care. But I think this quote is interesting. And again, this was done at the end of April. That it was a sleep apnea study and resulted for the end of May. And at that point, the gentleman who we spoke to was okay with it. But he was keeping his eyes open and watching the amount of test positives and things of that nature. And so I think everybody is moving quickly. It's a very fluid situation in terms of how people are thinking about their care. And so it's something we have to consider as we're reaching out to patients and we're developing our communication strategies. So one big piece of this, during this pandemic, one big piece that has come up has been telemedicine. And our research showed that usage of telemedicine had about doubled since the beginning of COVID-19. And we asked you all, have you adopted telemedicine in your practice? And the majority of you, 90%, over 90% have. And we also asked you, what types of visits do you find most successful with telehealth? And probably not going to surprise too many people here with these answers. Pink eye was one, common cold, UTIs, allergies and asthma. And so these are visits that are most successful. Some that aren't as successful, fractures, cuts and lacerations, sprains and strains. So I think some of these things are pretty obvious to all of us. But it was interesting to see what urgent care can do in this telemedicine space. And this is something that Alan and I will talk about a little bit as well as we move forward. So as I mentioned, about 15% of people had reported using telemedicine prior to COVID-19. And then since COVID-19, that almost doubled to 31.9%. And I think what's interesting about this is that it took the world of telemedicine years to get to that 15% mark. I think we've always seen statistics that have said 70 to 80% of the population is interested in telemedicine, but that usage number stuck around 10 and 15% for years. And then it just took a few months in COVID-19 for that to double and grow to 32%. Now, there's still a significant amount of consumers who are not using telemedicine, and we asked them why within the survey, and then had some more discussions further. So the most important reason is people prefer in-person visits. About 50% of the people we spoke to said that they are not using telemedicine because they'd rather just do it in person. There was some awareness issues, just not knowing where to start, and some concern about the quality of care. And so I think there's a couple of interesting takeaways here. Certainly, number one, there's always going to be people who prefer in-person visits. And I think that plays well into what urgent care does. But that there's also, if you are looking to build your capability around telemedicine, there's opportunity for awareness building, and there's opportunity to educate. There's a lot of people that are just not sure what to do, and there's opportunity to educate on the quality of care that can be delivered. I think one of the other interesting themes that we saw was that there's a lot of talk around healthcare media, conversations that we've all had about this may be this tipping point for telemedicine. And that certainly might be, that this might be the point that takes us where from 10 to 15% of people using telemedicine on a regular basis to a much higher number. However, one thing we found in our research at a very high level was that there was some it wasn't blowing people away, so to speak. You know, one thing we said, one of our researchers said, you know what, when I talk to people about their experience with telemedicine, their general reaction was, well, meh, like it was adequate. And it wasn't necessarily something they were going to do again in the future unless they had to. One person even said they felt forced to do it. So what that tells us is that, again, as I mentioned earlier, it gives us an opportunity to think about how do we design this experience in a way that meets the needs of people, because it's not just the old saying, if you build it, they will come. We're seeing that people are looking at this critically. And so some of the themes that we saw, acceptable for minor conditions, that was definitely something we saw over and over again. But there was some question about the value and accuracy. And so that led into a couple of different areas. Number one, people were not sure that they wanted to pay the same amount that they would for an in-person appointment for telemedicine. And so that's something we have to consider moving forward. And then there was some concern about accuracy, which tells us that it's important to make sure that we're educating people as we talk to them about how how you're providing diagnosis, how you're providing treatment, and why it's accurate, especially as situations are more acute. And as I mentioned earlier, the first-time users, definitely apathetic was a theme, and there was some experience challenges. It was clunky, and that makes sense. Many organizations, showed telemedicine adoption or telemedicine usage in their organizations go from 0 to hundreds within just a couple of months due to COVID-19. And so without a doubt, we were putting things together very quickly, adapting to the situation. It was very fluid, but at the same time, moving forward, if you see telemedicine as a core strategy, then take this opportunity to make sure that you're providing the experience, just as you think about your experience in your clinic, that you're providing an experience on telemedicine that really matches the expectation of what your patients are looking for. So going back to the in-person experience, one thing we're finding is that healthcare settings will need to prioritize cleanliness and safety more than ever. I think if there's one takeaway that I could give you all from this report, it's that you cannot over communicate safety and cleanliness enough. It's the number one thing people are looking for. They want to be assured, they want to be reassured, and then they want to be reassured again. One thing we've been talking to our clients about is, tell them before they get to your location how you're keeping them safe, how you're keeping things clean. Tell them while you're doing it, and then even remind them after. You cannot tell them enough. It's what people are looking for. And so one thing we asked you all in the survey prior to this was, what do you believe is most important for your consumers in order to draw them back to your clinics? And we asked you to rank those, and number one was registration and discharge without contact with a person. And then number two was no communal waiting areas. And those two were by and large at the top. The other three were much lower ranked by most people. Almost everybody put one and two as ranked them either one or two. But interestingly, then we asked you, what have you done differently for people who visit your clinics? And that was a little bit different. So number one, you had people wearing PPE. And number two, increased disinfection and cleaning of all patient areas, while the communal waiting areas and registration and discharge without contact were near the bottom. So that was interesting. What we found in our work was that number one, it's almost like PPE is a given, it's table stakes. And so that's really important to consider. But as we asked consumers to rank what's most important, the disinfection and cleaning was definitely number one. And then number two was the separation of sick versus non-sick patients. And so that reflects something that you all have been thinking about. And then the PPE, as I mentioned, the waiting areas and the registration without contact with a person, we're towards the bottom. So it reflects what you've been doing, which is a good thing and something to consider moving forward. Now, the other note I'll mention as I move over to the themes is that this is something that's going to continuously change. And I think this is an opportunity to, when you can, talk to your patients, whether it's through surveys, whether it's while they're in your office, whether it's when they call you, just talk to them about what their expectations are, because I think they're going to change very quickly. As I mentioned, this work was done in late April. And even since then, our world around COVID-19 has changed quite a bit. There's been quite a bit more focus on the transmission of COVID-19 through talking and coughs and breathing in particles or droplets, as opposed to touching things. And I think that may change how people think about what's happening when they're going into your office. So I think it's important. Certainly cleanliness is always going to be important and more important than ever, but it's important that you're keeping up with what people's perceptions are around safety, because those are probably going to be a moving target since late April when this was done and moving forward. So this quote here, we saw a lot of quotes like this. I'd be horrified if I went into an emergency room and people were sitting side by side, or no masks, and if they weren't taking temperatures. And if I saw that, I'd go back into my car and call them on the phone and try to ask them what's going on. So definitely that waiting room issue came up a lot. People would prefer, we're seeing a lot of news of people being able to wait in their car and getting texts when they come in. That's definitely a preference. As I mentioned before, PPE is table stakes, and really safety cannot be over communicated. So finally, let's talk about how people are delaying care. And this relates directly to what's going to make them more comfortable. So we talked about how they're looking at cleanliness and safety. And we're seeing 2/3 of consumers delaying all medical care for at least a month or longer. Now, I will let you know that we didn't ask specifically about urgent care at this point, but a lot of these findings can be applied directly to your clinics. And so this breaks down what we saw in terms of how people are thinking about medical care. So we asked them, once social distancing restrictions are lifted in your area, how long will you wait to get care? And so just over a third said within a month they'd be ready to go back. And then about 38% said they'd wait between 1 and 3 months. And one of the key themes about why they'd wait that long was that they would be waiting for the number of positive cases to decline. And so I think that's important to consider, because I think the news I saw this morning said about 20 or so states are still seeing cases increase. I'm here in Arizona. We're seeing a big increase right now. And so it'll be interesting to see how that changes people's perceptions and what we need to do. Does that push them back into the 3 to 6 months, or if we take the right precautions, are people going to be more comfortable? Uh, 11% of people said they'd wait 3 to 6 months, looking for more consistent information and reporting around COVID-19. And then 8.1% were going to wait 6 to 12 months, very long time, with businesses reopening and all restrictions lifted or that are in place to support social distancing. And then finally, there's a small group of about 4% that would wait a year or longer, and 3% said they would never go back. Which is interesting. But the other thing I'll mention is this is talking to the 40% who said they are going to put off care. And really what this all comes down to, and what we really heard as we did these interviews, was it comes down to, people looking for safety, people looking for that comfort. This was a gentleman talking about dental care. And again, late April, so you put it in perspective, in New Jersey, which at the point was having a large outbreak. I don't think June will be adequate for something as invasive as dental care. That could be maybe moved to September. Invasive as there are hands in my mouth that aren't mine, all these faces together. So, he did say he's okay with the doctor's appointment sitting across from each other, but as he thinks about something more invasive, he's going to put that off longer. So that's important to think about the type of care you're providing and things of that nature. So decision of care definitely varied based on the type of care. The closer people would get, obviously you get into surgeries, things of that nature, people were a little bit more hesitant. So, and then anything including close physical contact was something that people wanted to avoid. And so one piece I'd like to talk about is that as you think about your takeaways from this, there's really an opportunity to identify these key drivers of trust and confidence to get customers on a faster timeline. As I said, this is a moving target. Everybody's perspective is changing by the day around COVID-19. But the number one thing people are looking for is they want to feel safe. And so my recommendation to you for all of your clinics is to be thinking about what steps, pardon me, can you take to show people that you're providing them a safe experience. And I'll give you a couple of quick examples. One is, and I mentioned I'm here in Arizona. One of our health systems here is called Honor Health, and they have advertising right now that's really focused on safety. One of them is around these robots of coronavirus destroying robots that they have throughout their hospitals. And so they run this ad. And I'm not recommending you have robots, but think about the nature of the message about the steps they're taking to keep people safe. And they send them to see their safety measures. And they go into detail about all of these different elements that they take. So the enhanced screening, every entrance, every person, every time, separate areas for COVID-19. So calling it out, making sure that everybody is aware that the COVID-19 patients are being separated. Rapid testing, so ensuring that they can get test results. They're promising test results in 2 hours or less, but ensuring fast test results. And then testing before surgery. So there, obviously, we all know that hospitals are very focused on these elective procedures, and so they want to make sure they're talking about those, but think about what's important to your clinic and how you can make sure that you're demonstrating to people that they'll be safe in those processes. The PPE and masking. Now, again, table stakes, so it's number 5 on their list, but it's there, and they make sure they're clear about it. And then increased sanitation procedures. How are they cleaning? What steps are they taking? Another example that I found was Dignity Health, and taking the safety of patients and staff to a new level. And so this, again, very similar to what we saw before. They're just using some very quick visuals to demonstrate to people the screening, the temperature checks, the physical distancing, the masking, the cleaning, and the hand hygiene. And this really gets into something that we talk about with our clients as an experience design consultancy a lot, and it's around how people make decisions. And if I could leave you with some advice before we start talking to Alan, it's think about how people are making decisions in these days around COVID-19. And this is really relevant to how they make decisions at all the time. Um, you know, they're not just basing their decisions on rational or functional purposes. Decision making is very emotional for people. The emotional brain works about 1,000 times faster than the rational brain. And so it's emotions, and especially, you could think about how emotions run high in healthcare as a whole, but they run high especially during these times of COVID-19. And they're driving decision making. So patients are, when it comes to their healthcare, they're trying to make a change, whether they're trying to get better, whether they're trying to change how they feel, whether they're trying to just get peace of mind. They're looking for change, and it's important to think about how you can help them make that change. And so, one thing our research has shown, especially as we've worked with our urgent care clients, is that patients want more than just speedy times and close locations. They want those things, but that again is table stakes. That's what they expect. And one thing we like to think about is the difference between be goals and do goals. So be goals are desired states, those changes people are looking for, the relationship and the context of their lives at that time and the change they're trying to make. Where functional goals are the do goals. So that's momentary, how close, how fast, the activity I have to do, what's that relationship while I'm using a service. It's that immediate goal. And what I would recommend you think about, especially during this time, is how do you integrate the be goals into your do goals? And I brought up a couple of search ads that came up when I searched for urgent care here in Scottsdale, Arizona yesterday. And I'm not picking on these folks. They're both good organizations, but FastMed Urgent Care, close by my house. If you look at these ads, very much all about do goals, very functional. It's fast and affordable. It's my insurance. Here's what a self-pay visit is. Here's evening hours. Check in online, virtual visits available 7 days a week. Very much do goals. Next care, very similar. In fact, very similar messaging. And think about what people are looking for right now, especially in this era of COVID-19, and what we just talked about in our report. People are nervous, they're scared, and I would take the first opportunity I had to reassure them. And I think in many cases, your search ads and what comes up when people search for your organization are a great opportunity to do that. And so, something we've thought about in the past when we look at B goals, and these are more general, these are pre-COVID-19, people going on vacation and wanted to make sure that they didn't have anything serious. Their ankle was hurt and it just didn't get better and they kept waiting and waiting. I'm sure you've all experienced those patients coming into your urgent care clinics. I wanted to get tested because I had plans for the weekend. I wanted to be sure I didn't have the flu. Well, so those are some of the B goals that people had that really come down to peace of mind and how you think about how you offer that to people. But how have those changed now? And these are some of the quotes from our research. And so, people are nervous about the waiting room. And they're scared about that. They're very cautious about the mask, and they're sitting on the edge of their chair. They want to be comfortable that everything is sanitized. They want to be cautious with everything they touch. So, there's a lot of worry right now. And so thinking about how you can use your messaging from the beginning to help make people feel more confident and bring that confidence to them. And needs-based messaging is how we think about that. And so this is the last I'll mention about this, but if you could speak to people based on these types of needs, then you can differentiate yourself and create more preference. And so again, while convenience is important, how do you resonate with people's desired emotional state? And emotions, again, are very important during this time. So on the right-hand side there, the current state, I'm feeling nervous, I'm feeling ill, I'm nervous about the care setting, but I want peace of mind, my desired state of peace of mind. And so how can you, within your clinics, how can you take them there, and what role can you play in making them comfortable to get there? So with that, to summarize, again, I've said it many times, but it can't be overstated that patient safety and telling patients how you're ensuring their safety is incredibly important, can't be overstated. and continue to look for opportunities to understand your patient's needs, their motivations, their perceptions. I mentioned before, surveys, interviews, just even conversations at your location or conversations when you're doing a telemedicine visit. You can gain insights because it is going to be a moving target. People are going, their perceptions are going to change. It looks like we're in this for the long haul, and it's going to be an evolution over time. And so consumer perceptions and habits are going to shift quickly, and it's in your best interest to be prepared. So thank you very much. So with that, we're going to have a conversation with Alan. And so I'm going to stop sharing my screen so Alan and I can be on the screen here.
All right, great. You can hear me all right?
Yes. One second. And so Alan, thank you so much. I'm excited to get your perspective on this. And let's start out. I know you had a busy flu season last winter, and then COVID-19 came along. So what happened to Velocity's business during those early days?
Well, I think like many urgent cares, it hit us unexpectedly over the course of one weekend. So it was March 13th was the Friday, 15th was the Sunday. We saw our weekend numbers fall, and then Monday we just on the 16th of March woke up to a new reality. It took us about a week to get our bearings and realize, okay, this is not a short-term situation. And so then it took us another couple days. So within 2 weeks of the volume falling, we closed 6 locations. We furloughed about a third of our staff. We reduced night and weekend hours at the locations that remained open. So we, in order to preserve cash, realizing that this would be a longer term but uncertain scenario, we really just looked at right sizing the business. Our volumes after Monday the 16th, it really varied by location, but we were down between 13% and 85%.
Wow.
By location. The average across the company was down about half. So again, dealing with the new reality, we had to right size the business. We did at that time pursue rent abatement. We pursued the stimulus, the PPP. So really our initial focus was how do we preserve cash, right size the business to kind of weather the storm. And that was before we launched the COVID testing.
Yeah, well, thank you for that. And that's, I mean, and that's what so many organizations had to deal with is that shock to the system, and it did come so quickly. It was pretty amazing. So you did a lot of strategic work around thinking about how you could shift your strategies and the best ways moving forward. So walk us through some of those and some of the interesting tactics that you took.
Right. So when the idea that we could become a COVID testing venue came up, I was really hesitant. We were still trying to hold on to the 50% of the urgent care business we had, and I was hearing patient concerns that they didn't want to go to a germy place. We had competitors that had just locked their doors. Some moved all the patients to telemedicine. And in some cases that was because they had challenges securing PPE. Others, they were concerned about exposure to the virus. I was very concerned about branding ourselves as a germy place. So I didn't want to say we do COVID testing that would then run off what urgent care we had. What we were very quickly realizing was that the urgent care business just wasn't there. So this business I was concerned about potentially losing wasn't coming in anyway. So as soon as we were able to get supplies to do the testing, we launched the testing, and that it was really around the second week in April that we hit the throttle on that. One of the things I noticed looking around the marketplace was what some of the limitations were. And so in Virginia, we operate in the area that's coastal Virginia or Tidewater, primarily centered around Norfolk, Hampton, Virginia Beach. And then we also operate in Northern Virginia. And so in the Washington, D.C. market in particular, those that were offering testing had a lot of restrictions. Testing was more difficult to come by because you either had to be a member of a specific HMO that was doing testing at their own facilities. You had to schedule a televisit, and then after scheduling this televisit, they would schedule an appointment to swap you in the parking lot. That was really creating barriers for a lot of patients. Some of the hospitals did testing, but it required a primary care referral. People couldn't get into their PCPs. So we really launched or ran with this idea of testing without restriction. And so no residency requirement, no referral. And again, residency, you had to be a resident of a certain municipality or a county in some cases. So in Northern Virginia, we said no residency, no televisit, no HMO membership, no appointment, no referral, pretty much unrestricted testing, with the elegance that the consumers would come to the facility, line up, and we perfected the process within 3 or 4 days. But because of that, we were able to get fairly extensive news coverage in the Washington, D.C. market, which is 6.5 million people. And so our one location in Northern Virginia, we were pulling from the District of Columbia, we were pulling from Maryland, because we offered something that was not available elsewhere in the market. What we did in our core market, of the 6 locations we had closed, we reopened 4 of those as drive-up test sites. So out of the gate, they were doing COVID testing only on a drive-up basis. We later opened, and by now, all of those sites have restored to a full blend of urgent care and COVID services. But by designating specific COVID locations, and we picked them, we are in a geography where it's fairly separated by water. We have these geographic barriers. So in each one of our geographies, we established a drive-up test location that enabled the other locations that remained open really to focus on the injury illness care, and then provide peace of mind for patients that they would not be interacting with COVID testing patients, because those patients were going to the test facility. And again, we were early into our market with those locations, so got fairly quick recognition, but that was also because we took a very aggressive approach to our media buying.
Yeah, I think one lesson from that, there's probably several, but one I'll call out is around public relations and publicity right now. It's such a unique time in that we're facing a pandemic that we've never faced before. And as you and the operators that are on the call today think about what you're doing in your markets, there is going to be opportunities for you to reach out, whether it's print or TV or whoever it might be. Look for what you're doing different. Look for how you're contributing to help your community. And I think there's people want to, if you think about the themes of the report that I shared, what is making people more comfortable? How are you contributing to that? Because TV is going to look for that. I've seen that here in our market as well with healthcare organizations across the continuum, but being transparent and sharing what they're doing. So I think that's great that you were able to use that as well.
Yeah, and one of the things, so when the lockdown first hit Virginia, I was watching TV and I noticed all these ads for businesses you couldn't use. So if you think about who advertises on cable, it's car dealerships, it's furniture stores, it's various events, and these businesses were still advertising. Ford, Grand Furniture, you can't really go buy a car right now, I can't buy furniture. So I had the idea working with our agency to procure those ad slots. So we were able to buy starting in April. We actually filmed our commercial on April 8th. By April 14th, we were on the cable network, and we had acquired these ad slots from these other advertisers, the car dealer, that were locked into long-term contracts. They really were just kind of looking to get out of their ad slots. So we had not previously done television advertising, but we were really aggressive buying these ad slots. Just rock bottom prices we probably won't see again at that time. So getting on TV, and the message that we had was around cleanliness. So the ad, which you could see on our website, it's www.velocityuc.com if you want to watch the commercial. We used humor to address the cleanliness issue, and the reason for that, and it's kind of quirky. There's a local actor that has a Hollywood resume who produced the commercial for us. He actually stars in it with he has his wife and some of his friends, so they had a good time making it. But it shows a guy wearing scrubs, and he has at one point he has a leaf blower in our waiting room. He has a giant pot that says disinfectant. Well, you know, there's some people that looked at that and said, well, how could you make light of such a serious subject? But when we looked at how are we going to communicate cleanliness, we found that humor and parody was the best way to do it, because if we had actually shown what happens, our MAs, you know, with their Lysol wipes, the public would probably say, well, that's inadequate. If we showed somebody in a hazmat suit, full PPE, we know PPE triggers some consumers. It would scare them away. And plus, that really wasn't an accurate representation of what was happening. So we used the approach of parody. But the thing, by getting that TV advertising out there, we established our brand as the place for COVID. And we backed that with a aggressive PR campaign. So we immediately got in front of the press with, you know, this is innovative testing for the market. There were a lot of questions as to where can I go to get tested? What are all these restrictions? How do I manage this complexity? And so we went to the press and said, hey, we have this unrestricted model of testing in the Washington, D.C. market. The ABC affiliate, we were the top story of the evening, 6:02 p.m. on the 6 o'clock news. We had Fox, we had CNN in our parking lot, Fox in our parking lot, Getty Images, which syndicates to newspapers nationally, was taking pictures. So those were some advantages we had in the DC area. We were continuously covered on the DC talk radio. So in the Washington market, the news talk is the #1 listened to radio. Throughout the day, they were giving updates. And so that really helped draw into that location. And then in our core market, in the Tidewater region of Virginia, we became the go-to source. So we not only had that initial press push, which got us coverage because people just had questions, where can I go for testing? Well, you can go to Velocity. That led the reporters to be at our drive-through testing, you know, first thing in the morning, showing the cars, talking about the process. But as we evolved, you know, for instance, as we introduced antibody testing, as we introduced testing for the employer market, we would continue to follow up with press releases. So we've become the go-to source for media in our market, anything COVID. So now when COVID questions come up, they know to call us, and we've tried to keep them engaged throughout our evolution. So we believe we have well over 6 figures in ad dollar equivalent of free media coverage, primarily broadcast, but it does, you know, by extension, anything covered by broadcast news is covered on their website, it's covered on their social media, you know, as well as the newspaper and print media online as well.
Yeah, that's really incredible. And it is you know, you were at the right place at the right time, and you had a very strong message. There's going to continue to be opportunities like that, I think, for everybody here. So it's just something, sometimes it's about, you know, being on the lookout and thinking about those things. So you touched on this a bit, and I'd be curious if you could just share a bit more about the in-clinic experiences and how you're communicating and demonstrating the safety and how the cleanliness and helping patients overcome those fears that many of them have.
Right. So there were really 2 themes to our advertising. So I already addressed the cleanliness issue, which not only, you know, on the first television commercial we addressed through parody, but that is something that, you know, we continue to share the message that we're clean, we're safe, and we're open, addressing many of the concerns that you had. One, a lot of people, and because we closed some locations for a 2 to 3 week period, some of our competitors closed locations, the primary care offices were closed. So one, making people aware that we are open. If they weren't leaving home, you know, how do they know we're open? We're open, it's clean, and it's a safe experience. So, you know, with that, that's been a continual message. We rearranged furniture. We actually removed furniture from the locations. We have a web check-in capability through our queuing system that has text messaging capabilities. So with that, we let patients today know that if they register, check in and register online. They have the ability to wait in their vehicles if they choose. Now, it has been interesting, kind of based on feedback from your research, and a little different than what I've thought, because I've walked into centers, and even though the furniture is well spaced and well removed, and we have these distancing, social distancing in place, I'll walk in and there are people on the way around like, why are they here? Why aren't they in their cars? And what we've heard is that the consumers actually preferred to wait in the waiting room. Now they're not right next to someone, but we're also in an area of the South where it's already getting pretty hot and humid. And if it's over 90 degrees, people just don't want to wait in the vehicles. We certainly provide that as an option. And all of our marketing explains what we do, as far as the full PPE, the separation of patients, the sanitation of exam rooms, cleaning protocols. So we've outlined all of that, but really the two themes are, we're clean, we're safe, and we're open. And then the second theme ties into some points you made, is we're very blunt. The headline is putting off care is dangerous. So we know that statistically, ER visits in our market were down over 50%. The primary care offices were closed. Primary care in our hospital affiliation, now they'll talk about success in telemedicine. They went from about 300 telemedicine visits a month to 38,000. 38,000 sounds impressive. If you do the math, that's over a 1 month period, 30 days, 1,000 a day. They have something like 1,400 PCPs in their medical group. It's about 1 visit a day per provider. They were seeing 25 to 30 visits a day, at least, in their offices. So we know patients were not getting in for care. And this issue around PCPs is something we've even carried forward. Now that primary care is starting to reopen, there's an entire backlog of comorbid patients with chronic illnesses that were not seen during that time period. The PCPs are actively reaching out to them. There are a bunch of other patients that didn't get wellness exams, didn't get vaccinations. So we are finding in our market, PCPs are now backed up. If I were to call many primary care try to get a PCP appointment in our medical group or our affiliated medical group, they're going to tell me December as a new patient now. So we're now seeing 7-month delays to get into primary care. So we now have new messaging around that. Quit putting off care. It's dangerous. And we were seeing this in our clinics. We were seeing patients with cysts that had grown bigger than it should have. We were seeing patients coming in with conditions, like chest pain. They really needed to go to the ER. They were scared, and so patients far more serious and complex coming into urgent care because they had either put off care or were afraid to seek care from an appropriate venue. So we were very blunt and very direct in our messaging that quit putting off care. Putting off care is dangerous. We're clean, we're open, and we're safe.
That's great. And I think that's another great point to call out for everybody here, is that use that front page of your website. If you haven't updated it with relevant messaging yet, do it as soon as you can. I brought up the search ads. I think that's a great opportunity to make changes. I did a lot of searching yesterday around the country. I didn't see many search ads with COVID relevant messaging. And I know, Alan, I saw on the Velocity homepage some great messaging, and I hadn't seen a lot of that in other places. You see the bar at the top of the website that says, hey, here's how we're approaching COVID-19. Well, COVID-19's here. It's going to be here for a while. And so it needs to be part of your messaging. So I recommend everybody think about that. I'd like to wrap up because I want to hopefully allow a few minutes for questions. But Alan, can you talk a little bit about your approach to telemedicine and how you're thinking about it?
Having been in this industry, for over 14 years, I've kind of seen the evolution. And I think one of the challenges I've seen with telemedicine is, despite insurance companies, and you made this point as well, up until this year had spent tens of millions of dollars trying to push telemedicine. Conversations that I've had with payers, trying to spur urgent care utilization. The payers say, oh, no, we want them going to telemedicine. We don't want them going to urgent care. And statistics that say things like 85% of what's seen in urgent care can be done over telemedicine. Frankly, I don't want to condition my urgent care patients to telemedicine. I don't want them introduced to a platform that from now on they won't need urgent care. So that's one of my concerns. we did not pursue a telemedicine strategy. We really saw our primary strength as being the brick and mortar. And in our marketing, we actually say, you can't sew up a cut over telemedicine. We can't listen, we can't take an x-ray of your lungs. A lot of telemedicine calls are going to end with a referral to urgent care. In fact, for our medical group, the 38,000 that I mentioned, it was added to their protocol that the endpoint, because the PCPs were closed, would be a referral to urgent care. So I see telemedicine as a great source of referrals for urgent care. When I look at the economics of telemedicine, I believe everything on the internet's really a scale business. So, what started out, even watching the whole .com evolution, is that the large players, Amazon, they have strength, they have scale. So I think it would be very difficult from a cost perspective with the retail rents, the overhead cost of a brick and mortar facility for an urgent care to be efficient against a large platform like American Well or MD Live. To me, it would be kind of like Amazon, arming independent little stores, mom and pop stores, saying, okay, we're going to give you a website, now you can go compete against Amazon. Sure, there's local business that may be there, but really looking long term, I see our strength is the brick and mortar, the opportunity to do procedures, take x-rays, things that cannot be done over telemedicine. And I think by leveraging that strength, that's going to be what secures urgent care in the future. Otherwise, urgent care would just be a more expensive venue for things that could be done online. And then the other challenge I would see, if the clinics are slow, certainly seeing patients via telemedicine could improve productivity. But if a clinic is fully productive and a provider is efficient, seeing kind of their optimum number of patients per hour, how do I integrate patients sitting in the lobby, walking in, patients who have registered online, as well as people just sitting there, waiting for a video visit? So I see complications in flow and operations as well. So really kind of based on those things, we decided that the telemedicine that was being used by the medical group could be a great source of referrals for us, but we did not actively pursue a telemedicine strategy ourselves.
Very interesting. Well, thank you for sharing that perspective. Carla, I know we have about 8 minutes left. Are there any questions for Alan and myself?
We do have a few questions. Okay, so I think this would be directed to Alan. How did you handle the work status on patient testing? Are they quarantining until the results come back?
Okay, so I'm not a clinician, so I leave those types of things to our clinical leadership, who have defined the protocols on how to handle that. I do believe that's I think it varied. I think it actually changed, and I think it varied by their work function. So I would actually rather have one of our clinicians talk to the precise protocol that they have in place and that's been vetted through our provider organization than speak to that as an operator.
Sure. Okay, what was Velocity UC's method for getting involved with local departments of health and or other organizations to ensure you are part of the conversation and included in the state and regional outreach?
So one of the things, I was actually appointed in Virginia to the Governor Ralph Northam's subcommittee on COVID-19 testing. And so that represents that, it includes public health, it includes FQHCs, retail drugstores, hospitals, medical groups. So broad representation. I think one of the challenges that we've seen is that the information has only been flowing one way, and that is to Richmond, not from the government to us. So, as a provider and one of the largest urgent care platforms in our markets, we have received very little guidance or direction from public health. Where we've participated, we've reported what we're doing, what we're seeing, and it's more like, okay, thank you, that's great information, but we've not had a lot of collaboration in return. So I think think that's really probably an opportunity for improvement. You know, the next time this rolls around, you know, if ever, is creating greater collaboration. So as a provider, we don't feel that we're kind of out there on our own, left our own devices figuring this out.
All right, great. Okay, all right, here's the next question. Hold on, have you considered exterior and interior digital signage for local and a rapidly changing environment? We had success changing a location focused care using this method.
I love the idea of digital signage. Unfortunately, in Virginia, most of the municipalities, if it's not Georgian colonial architecture, it's not going to pass any kind of permitting process. And in the municipalities where we could have it, they require static message. So in the city of Norfolk, you have to have the same message all day. It can't flash, it can't rotate. So when we've evaluated the digital signage, it's just something that has not been available in the markets where we operate. I agree where I've seen it. I think it's a great way. But one of the things I will add that we did, we operate, unlike many urgent cares, we operate in some urban areas. We're a Medicaid provider, and we operate in you know, what would be considered a, you know, an urban or inner city environment. With that, our traditional methods of reaching people, you know, we were concerned we may not be reaching the people that in the community among the Medicaid populations that we really need to reach. Are they on Facebook? Are they, you know, are they watching cable, or you know, or accessing these other means? So we actually went out. I would not do this outside of a crisis situation, but we actually posted yard signs throughout our community. So, you know, at the intersection where you pull up and it typically says, you know, haul your junk and sell your house for cash. Again, that's not how we would typically represent our brand, but we had a very important message we needed to get out. So we went out into the community, we posted these signs, and amazingly, and I still drive around, some of these signs are up 70 days later. What we found, oftentimes, you know, when they would cut the grass, the landscaping, you know, that's when they, you know, they would come down. But because of the message of the COVID testing, the availability of COVID testing, a lot of you know, places left these signs up even as they cut the grass around them. So that was kind of a guerrilla tactic out in the community. Certainly, we found that in our specific locations, despite some fairly strict municipal regulations, that seeing restaurants putting signs out for their carry out or curbside service, that the municipalities became fairly lax in enforcement. So again, at our physical locations, we put these yard signs out. They're bright yellow. You can't miss them. Very simple message, COVID-19 test site. And now what we're doing at the physical location is, now that people know that we offer COVID services, we're transitioning that signage as we add back our weekend hours to the yellow yard signs on our own property. No longer say COVID-19 test site, they now say open 7 days. So people, you know, will say, you know, be aware, okay, they're now open on the weekend, you know. So trying to keep in constant communication with our patients. And something else, you know, not really on the point of signage, but leveraging email lists. We send out a bi-weekly newsletter. When we change hours, we send emails and targeted text messages to the former patients of that location as well, just to inform them of our changes so they can keep up with us.
Okay, are you seeing a lot of patients return for just regular, you know, urgent care?
Yes, yeah. So we are actually intentionally trying to wean ourselves off the COVID testing. So from a volume perspective, we, after seeing the initial 50% increase, we then jumped back to flu levels. Whereas the June, even now in June, the average urgent care would be approaching their off season. You know, June would typically be off season. For June, we are actually exceeding our year-over-year volumes because we're still performing at flu levels. A high percentage of that is related to COVID, kind of beyond my comfort level because we do see competition coming into the market. 39 CVS stores in our core market here recently launched the testing. Again, with that, we inform patients of some of the challenges. We say self-swabbing has not been proven to collect an adequate specimen, when we get asked about these things. But, with COVID testing becoming less unique to us and, kind of our first mover advantage now expiring as other competitors are doing this, it is imperative that we get that core injury and illness business back. And so our focus on our messaging now is around quit putting off care, 7 months to get a PCP appointment, things that you can't do via telemedicine, to really emphasize to consumers, we're here, we're safe, we're clean, you have nothing to worry about, and we can meet your medical needs because we know you're going to have access challenges elsewhere in the community.
Okay, great. So we are at 2 o'clock, and that is, basically we're answered most of the questions that have been asked. So I would personally like to thank both Steve and Alan for your time today and, sharing this great information with us. As everyone exits the webinar, if you can please take the quick evaluation to let us know what your thoughts were. And that will end today's COVID-19 webinar. Thank you.
Great. Thank you.
Thank you very much.